We talk a lot about stress and pain often being connected, but this recently published review asked a more precise question. Are measurable stress system related changes actually related to pain sensitivity? The authors looked across a range of chronic primary pain conditions like fibromyalgia, IBS, chronic low back pain, complex regional pain syndrome, and pelvic pain to look at changes in the autonomic nervous system and the HPA axis, the hypothalamic pituitary axis. Now, the TLDR overall finding was that yes, altered stress physiology does seem to relate with altered or increased pain sensitivity, but it's not in a clear or reliable uniform way. Some things were clearer than others. Lower mean arterial pressure was associated with greater pain sensitivity. Higher baseline cortisol was associated with lower pain pressure thresholds, and higher heart rate, especially during stress and recovery, was linked with greater pain sensitivity, particularly in those widespread pain groups like fibromyalgia. There was also a recovery signal. Lower high-frequency heart rate variability during recovery was associated with lower cold pain tolerance, which suggests that it might not be so much how strongly the system reacts, but how quickly it settles and recovers. Now, we can't forget the nuance. Not all associations were clear or mattered all that much. For example, systolic and diastolic blood pressure did not show clear relationships with pain outcomes, and a lot of the literature was mixed. This is still emerging evidence of low to medium quality, but it does show us that altered stress physiology impacts the pain experience. It's not as simple as more stress equals more pain, but it links to what we've been saying for a long time now, that to better understand and manage your pain, it's helpful and important to consider the broader context of your life, things like sleep, lifestyle factors and behaviors that impact and are impacted by our stress responses.